Hi everyone, Sam and Emma here from PodiPedia. Today we're doing a short video on tibialis posterior tendon dysfunction, otherwise known as adult acquired flat foot.
Yeah, and it does say adult acquired flat foot, but we can see dysfunction in this tendon in children as well.
Yeah.
It might be worth saying. So this is a very important tendon. The tibialis posterior tendon runs down the inside of your leg, so near the tibia bone, and behind the malleolus, which is your medial malleolus, it's the ankle bone, and it inserts into the navicular prominence, this one here, and several other bones underneath the foot as well. It's really, really important postural muscle, and when it goes wrong, it can cause a lot of problems.
Yeah, think about it being on the inside of the muscle and the tendon. Its job is to keep your arch of your foot, which is what's called the arch of the foot, up. And support it. So when the tendon is not working properly, what tends to happen is you get pain and swelling in that tendon, but then your foot starts to deform. The medial arch will start to flatten in the early stages, and then there's the later stages of the condition. As it progresses, the toes can start to turn outwards, and you can develop sort of bony changes, arthritic changes in the foot. So it's a progressive problem that starts off very sort of moderately and can become very, very severe.
Exactly. So what the key to treating this is early diagnosis and early treatment and intervention, because if you let it progress and you sort of leave it to its own devices, it generally doesn't get better on its own. So one of the classic tests that you can do to see if this might be the problem that you're having is try going up on your tiptoes, particularly just on the leg that's sore. So if you've got pain behind that ankle, stand on one leg and try and do some calf raises. So try and go up onto your tiptoe and 10, 15, 20 times. If you can't do that, or you're finding it really painful, then it's probably this problem and you need to go and see a podiatrist.
Yeah, if it's causing a lot of pain as well, don't push through it, go get assessed.
Yeah.
What we also find is it does seem to be what we call a unilateral problem. It affects one side initially rather than both.
Yeah.
But there are so many other things that can cause pain in the arch area, in the inside of the ankle, in the heel. So you really do need to go and get it assessed and get it checked out and see what can be done. But the good news is there are treatments.
There are indeed. So we'll start with strength and conditioning and exercises, maybe some strapping and some footwear alterations, and then we can move on to some more advanced treatment, possibly some foot orthoses depending on the stage, and then we can move on to
looking at maybe braces if needed, more ankle foot devices which are more supportive, and then even sort of looking at different imaging to look at the tendon and the other structures involved, MRI, X-ray. Then possibly treatments such as shockwave therapy, steroid injections, various things to try and help pain, and ultimately there are surgical options available, though this tends to be on a case-by-case basis, and when surgery is involved, it's about trying to improve function of the foot or reduce pain or deformity. So
it's sort of end stage stuff, really, the surgery. But like we've just described, there are so many things that you can do to help this, and it's often very successful. So don't suffer in pain if you've got this problem, or you think this is the problem you have. Go and see somebody, get it assessed and diagnosed properly.
What we often find as well, a really key point, is that people really upset about not being able to find footwear to fit when their foot is because one foot may end up being quite a different shape to the other.
Yeah.
So seeing a podiatrist early can try and prevent this, and you can get really good advice on footwear early on, which is really important as well.
Absolutely. So how can they find a podiatrist, Sam?
Go to the PodiPedia.co.uk website, have a look on the directory, find a podiatrist near to you. There's also more information about this condition and other conditions that affect the same area, so you can look at differential diagnoses and various things. And if you like this content, hit subscribe to the video, and we'll be posting more in the future.
Bye.